Hello, and welcome to the latest in our series of AI Med Talks. I'm Alexis May, Content Director at AI Med, and today I am joined by Chanel Fischetti, Chief Medical Officer at Centaur Labs, who is also a practicing emergency room doctor. Chanel, thank you so much for taking the time to be with us today.
Thanks for having me.
Today's discussion will focus on an outstanding initiative that Centaur Labs are leading. But first of all, Chanel, I hope you don't mind my taking the opportunity to ask how things are going in your other job in the ER.
Yeah, it's been a wild ride. Pre-pandemic, I was splitting my time between my company and my clinical sites, only doing about 5 or 7 shifts a month. Now I've obviously shifted up because there's been such a need for doctors in the United States, obviously around the world. And so I've been emergency credentialed at another hospital nearby. So I've been living out of a suitcase and just driving between different hospital sites. I'm currently in Connecticut, and the hospital I work at is in Greenwich, so it neighbors New Rochelle, and it's unlike anything I've ever seen. 4 weeks ago, had you asked me if this could have evolved so rapidly, I don't know that or at least I was probably trying not to believe the media reports, but it's the real deal. Most of my patients in Greenwich, especially right now, have COVID. So just trying to take the necessary precautions, but the shifts have definitely been a little bit more draining than normal. I think because you're constantly, thinking about gowning and ungowning and, did I touch my face? Did I wash my hands? So it's just been an entirely different experience, but I'm really proud of my colleagues, other nurses, doctors who have just, I think, stepped up and really tried to take this virus on. So it's been a whirlwind.
Yeah, well, Chanel, please allow me to convey my sincere thanks on behalf of AI Med for the incredible job that you and your healthcare colleagues are doing across the world right now. Thank you.
Thank you.
Now, to come back to your work with Centaur Labs, can you give us an overview of the project you're working on in collaboration with Kaggle and Radiopaedia?
Yeah, so traditionally as a company, we work with other companies or hospital systems to do data cleaning or annotations for different data sets that they need done. This one that we're doing in conjunction with Kaggle and Radiopaedia has ideally been designed to draw more attention to what they're currently trying to do. So obviously you've seen other data science websites or companies in general, especially in the AI field, try to either piece together like the population health data. So where are these new cases popping up? Like what are their traditional demographics? Kaggle specifically and Radiopaedia are focused on the actual images themselves. So the chest x-rays and CTs being completed on these patients. And what they've done is they're trying to mostly crowdsource and kind of gather almost like a central hub of chest x-rays and CTs that other providers or data scientists or anybody can view. And I think that's really important in something like a pandemic where, this is a new virus. People aren't, especially providers, aren't as used to maybe seeing these pathologies on chest x-rays or CTs. And so, for areas like, for example, in Greenwich, now it seems like every patient has it, and the physicians I work with there are a little bit more familiar with what COVID looks like on chest x-ray or CT. For areas like rural areas or other areas that haven't been as hard hit yet, they may not be as prepared because they don't know what to look for, either in the early stages or the late stages of disease. And so the importance of this kind of Kaggle data set, Radiopaedia data set that's being gathered is to provide other individuals and providers with this information. And so where we come into that is our application is a gamified platform where practitioners or other providers or healthcare workers can come on and see image after image and learn pattern recognition through the abundance of images on there. And so what we were hoping to do is we've imported Kaggle's images and data sets to provide an easy platform for others to view these images. And so sometimes I think it can be a bit of a barrier if you're not in data scientist or in data science, or if you're not in AI, to know how to use that technology to your benefit. And so we're just hoping to make it more accessible and easy for people to see these images.
That's a really great initiative. Thank you, Chanel. Is there anything that the global AI med community can do to support this work?
Honestly, everyone's been so supportive, whether it's family or friends or just other people in general cheering us on. Other companies have been really helpful from a physical standpoint, whether it's like helping with hotels or car rentals. From a data science and AI perspective, especially for AI in medicine, our biggest goal as a company is to just promote this data set that Kaggle and Radiopaedia are trying to gather. And so we're indirectly obviously doing it by trying to redirect sources and images to Kaggle to build this data set. But the ultimate goal is just to raise awareness about it. If there's one central area where we can just kind of pool all of our resources together, that being images in this case, hopefully we can come up with AI algorithms earlier or sooner rather than later to optimize, earlier medical diagnostics, or, even something as basic as this is what COVID looks like early in disease process versus later in disease process. So we're just hoping to kind of generate an awareness to support these other organizations as well.
Okay, wonderful. Well, thank you. And I mean, you alluded to this a little bit before, but I wanted to ask you as a final question, as a clinician with some data science expertise, how do you see the role of data science in managing and mitigating not only the present pandemic, but as we move forward to the future as well?
The fortunate and unfortunate reality is that we're doing this mid-pandemic. AI has kind of been in the forefront of medicine, especially in the last several years. I think you're going to start to see, obviously all of us are kind of scattered and trying to put pieces all together real time, but I think you're going to start to see, hopefully there's not a next pandemic, but if there is, we'll be a lot more prepared in terms of how to organize data. And I think, whether that's in the form of this data is going to help us find a vaccine sooner, this data is going to identify which drugs and medications are going to be more effective sooner. I think a lot of data science right now is trying to do that both with population health data and obviously even with like vaccine and medications. And I think that the organization of it hopefully will improve in the future. I think that, companies like Kaggle, AI in medicine, everybody else is just trying to generate this information so that others can be, so it can be basically available to any other researcher and scientist also trying to work towards the same thing. But I think a better organizational system could probably improve as we evolve. But, there's a lot of information out there right now. There's a lot of inaccurate information. I think learning to sift through that is going to be an important role that data science will play in the future.
Yeah, absolutely. Chanel, thank you so much again for your time today. It really is greatly appreciated.
Yeah, no, thanks for having me.
Thank you, and thanks to everyone for joining us. Please do keep an eye for more AI Med talks at www.ai-med.io.